Today's quality measure is cervical cancer screening. As an overview, the denominator includes members 21 to 64 years of age, and this applies to all payers. HEDIS has changed the term from women to members. Members may include those with administrative gender of female, sex assigned at birth, and sex parameter for clinical use of female. This recommended statement applies to all asymptomatic individuals with a cervix, regardless of their sexual history or HPV vaccination status. It is also recommended for transgender men and gender-diverse people who retain their cervix. For the numerator, per HEDIS, they are members 21 to 64 years of age screened for cervical cancer using one of the age-appropriate options below. Cervical cytology must be performed within the last 3 years. The age range is 21 to 64. For HPV testing or co-testing must be performed within the last 5 years. The age range is 30 to 64. The 2024 measurement period is January 1st, 2024 to December 31st, 2024. Pap smears are to be completed from January 1st, 2022 to December 31st, 2024, or 3 years. HPV tests are to be completed from January 1st, 2020 to December 31st, 2024, or 5 years. This measure's exclusions include patients who had hospice or palliative care services or are deceased, a hysterectomy with no residual cervix, and members with assigned sex at birth of male at any time during the patient's history. All of the following are required for documentation: a note in the medical record indicating the date, month/year, type, and the result of the cervical cancer screening. For cervical cytology, count any screening method that includes collection and microscopic analysis of cervical cells. For HR-HPV tests, generic documentation of, quote, HPV test, unquote, can be counted. Here is an example of a cervical cancer screening. This lab is a pap smear. In multiple places, it shows the type of test. We're also looking for the results, which is also shown in 2 separate places, such as normal and negative. And for the date of service, we're specifically looking at the collection date. This lab can close both the cervical cancer screening and the chlamydia screening, though supplemental data such as an office visit note must include the same information as shown in green. Common insufficiencies. Do not count lab results that explicitly state the sample was inadequate or that no endocervical cells were present. This is not considered appropriate screening. Lab results that indicate the sample contained no endocervical cells may be used if a valid result was reported for the test, such as negative. Do not count biopsies, as these are diagnostic and therapeutic in nature only. Documentation of hysterectomy alone does not meet the criteria. Use verbiage such as complete, total, or radical. Relevant codes that a primary care provider is the direct biller are listed below. Submission of these codes will close the quality gap through claims with the payer, especially when medical record review is unavailable. Let's review some best practices. Upload lab reports into your EMR and label clearly for easy identification. Ensure workflows are in place to notify and remind providers of when a patient's next screening is due. Make follow-up phone calls if patients have not completed their screening. Educate patients on the risks of cervical cancer. Refer patients to ACN's care coordination for additional support. Continue working with your clinical performance consultant and use ACN's additional resources. Visit Arizona Care Network's website for updated 2024 tip sheets and additional quality measures. This concludes the cervical cancer screening training course. Thank you for listening.